Just a small town girl with a big old dream. Now she's taking it over and making a scene. Yes, it's your turn next, so please take your seat. 'Cause baby, the best is yet to be seen. Good morning, sunshine. Good morning,
Sunshine's Corner, being brought to you by Quint and Richie Studer.
Sunshine's Corner.
And good morning, ladies and gentlemen. Welcome into the hottest spot in town. This is Sunshine's Corner, where purpose meets power and conversations create change. I am your host, Sunshine, and today we are diving into an important conversation that affects every one of us. We're talking about something I didn't know about. It's called population health. Okay, when many people think about health, they think about doctor visits, they talk about hospitals and medication. But population health goes much deeper. It's about understanding the overall health of our communities, the factors that influence whether people thrive or they struggle. Did you know that? I sure didn't. From access to health care and to healthy foods to housing, to education, transportation, mental health services, and all of this with the economic opportunities, population health looks like a bigger picture. And it asks about the important questions. What do we do together to help the entire communities? How do we help them live happier, longer, and more fulfilling lives? Think about that. You never thought about this population, right? So today's conversation will explore how population health impacts families and neighborhoods and schools, businesses, and the future of our community. We discuss challenges. We discuss opportunities, the practical solution that can help create healthier outcomes for everyone. I can't wait to get in this conversation. This is more than a healthcare discussion. It's a community discussion, because when one part of our community struggles, we all feel the impact. I say it all the time. And when we work together to improve health, the well-being of everybody, we all benefit. So get ready, sit back, get that cup of coffee, and relax, because it's going to be an empowering conversation. Grab it, grab your friend, tell them, pick up the phone now, we got to watch this today. We can explore how we can build a healthier community that has a brighter future. I want to welcome to Sunshine's Corner, the place where purpose meets power and conversation certainly creates change. Let's get this conversation started. I want to say it is Wellness Wednesday with Joy, and I said, Joy, well, welcome into the new place.
Yes, it is gorgeous. And that promo, that intro, whoo, that's my people y'all saw on that intro. That's my people, Sunshine. That's my people.
And Emily, you know what? We met coming on the elevator. We were both coming out the rain. But, you know, it was her personality. It was that I could feel the warmth of her when I looked around. I said, well, good morning. And we ended up coming on the elevator, coming together. Thank you for coming in today, Emily.
I'm so glad to be here. Thank you for having me.
But
yes.
Of course, look, I'll call Joy. I said, Joy, what we're going to do? Who we got today? When you think of somebody to do this with, give me a minute. But, you know, I say that. I had never, when you said that to me and said population health, I said, okay, what is that? I never heard of that before.
Yeah.
I mean, and now to see how this is going to dig deeper, not just going to say, oh, my arm hurts, or why my heart palpitating. It's deeper than that. How did you, I mean, well, you're in the medical field, or you've been knowing about this.
So population health, I was actually a manager of population health 15 years ago. So somebody had to teach me what I knew community outreach, and population health really looks at the data to say this is where you should spend some time.
Okay.
And so you know, that's what we do at Baptist, even with the faith base. You know, us with the Faith Health Network, we look at the data of how the parishioners, how many days between hospital visits, or how many times they use the emergency room. We look at all of that data to make sure we can plan interventions for specific populations. And so Emily and her team, they do some amazing things. And I'm gonna let her talk about a couple of them. But population health, it's more than just about Joy. It's about all the 50-year-old women in a certain place and the challenges that we're having.
Excellent. Like, you say, I mean, you got me stuttering. I mean, and I don't stutter.
She showed up.
I mean, Emily, tell me, how did you get into population health? How did you become a part of that?
Absolutely. So I kind of stumbled into it myself. I am a medical coder by background. So yeah, what is that, right?
What is that? Yeah.
So I actually am certified and trained to extract alphanumeric codes from documentation.
Let me break that down.
Did y'all see this face?
She looks at codes in the diagnosis. So whenever a physician diagnoses you with something, there's a code that goes with that. That's what they send to the insurance company. That's what they send. So she looks at those codes.
Okay. And that's how, so we send those codes to the insurance companies, and that's how we get reimbursed for the services we provide.
Right. If it's not coded properly,
you don't get paid.
We don't get paid.
We don't get paid.
Oh, I'd be right there. Okay, let me see.
62115 doctor.
So it's important, and coding has actually continued to be an important part of my role, even in population health, because as Joy mentioned, a lot of what we do is focus on the data,
right?
To help us understand those populations and understand where we need to focus our interventions in our community outreach.
Absolutely.
So with coding now, what I focus on is risk adjustment, and that is utilizing diagnosis codes, so codes for conditions and diseases, yes. And each of those codes may be assigned a numerical value that assigns the disease burden to the patient population.
Wow.
So for instance, a patient may present to us with diabetes and hypertension and, let's say, chronic kidney disease. There are codes that exist for each of those conditions, and then there's also codes that link those conditions.
Oh, really?
Yes. So we can infer causal relationships between certain things.
Right.
Meaning the chronic kidney disease can be inferred as a comorbidity of the diabetes.
Right.
What? A comorbidity?
It helped call. It
now
happened
I got a new word now, comorbidity, okay?
Sorry, yeah.
It happened because of, right, yeah.
And it lives or exists in the same environment.
Right.
Yes.
Unbelievable.
Yeah, so, but as those codes are utilized with risk adjustment, it increases or decreases a particular score for a patient or a patient population.
Wow.
And that tells the insurance companies or the government, because the government also uses this, to how much it is estimated to cost to care for that patient. So for instance, if that patient that we saw that had diabetes, chronic kidney disease, and hypertension, went to the emergency room, let's say, for a diabetic incident.
I understand.
Yeah, yeah. Blood sugar's really high, everything's going awry, goes to the ER, and then eventually gets admitted. We're actually monitored on our readmission rates. We're monitored on how often those patients go in and out of the hospital and for what reason.
And the length of their stay.
And the length of their stay. Yeah. And we try to mitigate that as much as possible.
Unbelievable.
So with the coding, it helps us mitigate what cost we're on the hook for from a healthcare system standpoint. And when we use that coding properly, it tells the insurance companies that there may be a higher disease burden for this patient or this population. So you would expect to have to pay for certain services or a certain level of services. Yeah.
Girl, you got a lot on you. I've been saying number what? Who? 99999.
Yeah.
A lot of numbers.
What does Jeffro Bodine say? North.
Yeah. It's very, so a lot of times when we think about healthcare, we see the clinical pieces, the doctor seeing the patient, even the social worker with social services, but we don't think about the back end. We don't think about the back end that's making the whole wheel turn. And then a lot of times hospital systems, they get a bad rap because it's like, this surgery I felt like should have been inpatient. Okay. But if the codes and the insurance company said this is outpatient, guess what happened?
Outpatient.
It's outpatient, and so we take the rap because it's like Baptist put us out, but we're based upon those codes and what the insurance says it needs to happen.
So if it's outpatient, that means you just go in and
you do it in the morning,
like
come
a
home.
triage room, get it done, and go home.
A operating room or a procedure room or.
So if I get a surgery, if it says outpatient, I get that cut. That day I got to go home tonight.
Same day.
And your insurance company can dictate
they
that
dictate
for us.
that.
They can dictate
Yeah.
that?
Yeah.
But see, the community and the patients, they only see the hospital.
So they say it's the hospital when it's really the insurance
It's
company.
Yep. It's who says we have to do what.
Get out of here.
We even found ourselves in a situation with some of the preventive services this year where a certain payer requires that the colon cancer screening, the colonoscopy, is performed in an ASC setting only.
What's the ASD setting?
An ambulatory surgical center.
So like,
We have one at Nine
Mile.
Mile, and is there one at Gulf Breeze?
no.
So they go in there and have it. Really?
But we can't schedule them at
The
Maine
hospital.
Baptist because the insurance company requires them to be done at a certain facility type.
Same thing with MRIs. So we may have a patient who wants to come in and get an MRI at Baptist.
Right.
Baptist Maine, Gulf Breeze, but their insurance company says that they have to go to not a freestanding, what do they call them? A specialty imaging center. So they may end up at Touch Point. They may end up, somewhere else because the insurance company says we're not going to pay for you to get this done.
So if they found out something wrong, then you can go to the hospital. If I had an MRI and then they say, okay, your heart is going boom, 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 boom. There's something over there I don't recognize. Then I can go to the hospital.
Now they ain't gonna do no MRI on your heart. Let's start right there.
I
So
mean-
if it's like for me in this hip,
it's
like
a hip,
it's,
but I mean,
yeah,
put you in that tube,
But what
right?
that-
To your point, yeah, you
You get
might
what I'm
end
saying.
up back
You may
at
see
the
something
hospital.
else.
Yep,
Yeah.
yep.
And that's kind of the problem that we're trying to solve in some ways with population health, because what we can do is we can make the case for our services to be done, as quickly as possible, in-house if we can.
What?
Because it's the right thing to do for the
Right,
patient.
okay.
And so we advocate for them.
Suppose I'm
With
one of
the
them places that I want to go. I need this. I think so I just be screaming, right?
We get that. We get that. And then when you go so we always talk about the continuum of care, right?
Right.
Internally, we do all we can to make sure that it is seamless care coordination. But when a patient has to go somewhere outside of Baptist, there's a gap because now we have to rely on somebody else to send us imaging or before we can complete this whole continuum of care.
Wow.
So imagine, especially in a population health sense, imagine that your primary care provider is in the center of the hub with you.
Your family doctor people, your family doctor.
Family doctor, yes.
That was my next question. Who are they?
Who are
Okay.
they? Yes. And they are caring for you at the patient level, patient-centered care, and then outside of that, there's a layer of care navigation, let's say, and that's going to be my team on the Pop Health team. We do a lot of outreach to patients to help navigate the system. And then it becomes referrals out to specialists or for services that are needed, like the preventive services and things like that. But it all is supposed to flow back to the primary care provider or the family doctor so that they can remain at the center and the most knowledgeable about the patient. And the reason for that is because the family doctors have a longitudinal relationship with a patient, meaning we build a relationship with you that lasts over a span of time and not just because you got sick. It's more of I know you, I know your family history,
right.
I understand what your wishes are from a healthcare standpoint, and I've got all that documented in your record. I know where you go for your specialty care. I know where it's all about that empowering knowledge to help manage from a proactive standpoint.
I hear you.
Which is exactly what we're aiming to do.
Which is why you've heard me. Remember we had Jason on?
Yeah.
When we talked about primary care, which is why this whole year, these next couple of years, we are really primary care. That comes first. You got to get that family doctor, that coach of the football team. Remember, I always use that analogy.
Yes, I remember.
We have to establish that.
Right.
And there is primary care for people who are uninsured.
I was coming there.
Underinsured. You know, what Community Health Northwest Florida does with their sliding scale, what Health and Hope does. There are other places that you can go if you're under or uninsured too for primary care. But we want the whole community. I wish I could just put that on a t-shirt and with a QR code for you to scan it so you can make some appointments. But primary care, that comes first. Yeah. Without that coach, the ball just going everywhere.
Listen at this. Okay, like when you were talking about that, and we were talking about insurance and all that, with the economy how it is now, and there are so many people that are lacking in that area. But you answered my question. You said for people who do not have insurance, there's still a way that you can get to have that primary care, so that if something should happen, there is a roadmap, to what's been going on. Because you know, so many people now with and we were talking about this. I think her name is, I can't remember her name, but Clark somebody. But we were talking about health because she works with the health center you just talked about, Northwest
Health Northwest Florida.
She works there. And how many people will wait for that emergency room when they wait till they just can't not stand the pain anymore? But the answer to that question, that what I'm trying to say to you, my dear friends, there are places you can go if you do not have any insurance. So don't let that be an embarrassment because that you're not able to do what you did 5 years ago. We all see what's happening in the world today. So get what's there for you. Yeah. They got a place for you no matter what. Yeah. To make sure you take care of the only temple you're ever going to have.
That's right.
You only got one. And I think that's great when you talk about population health. It's not looking at just everybody. Every citizen out there, we care about it. Every citizen out there that got to know that there's a way that we can get the help. If you go back to years past, well, that's all they had was a clinic.
Yeah.
You think about it, all they had. I remember my mother used to load us up and put us in the truck. You knew you had to go to the clinic. I mean, it was a clinic day that you had to go, but they made sure that they got us there every year, even when it comes down to things. If you feel like you're getting sick, you always go back there, go to that same doctor, but it was a clinic.
Yeah.
During those years of growing up.
And think about even times before them when the primary doctor used to knock on the door.
Oh my God.
With the doctor bag, you know, and
Okay, Opie.
And you know, it's so important that technology is trying to compensate for what we're skilled at doing as a human. And there are actually AI pods that are trying to replicate primary care now.
AI is trying to do everything. AI, no. Get it?
Dr. Google and Dr. ChatGPT
alone. ChatGPT,
but they'll never be able to replace the human connection.
And I always say that too. Now that it's growing, but you still need a human.
You got to have that touch.
You got to have that human no matter what. Ladies and gentlemen, we're talking about population health today right here with Joy. And of course, Emily, she's graced with her beauty here with us today to share things that you need to know. And I want you to sit back because we got a lot more to cover because it's all important for you. And where do you get this information? Every single day right here at Sunshine's Corner.
I learned during my military service to train every day to fight and fight to win. If you've been injured in an accident, you already know one thing for sure. The insurance companies are going to fight you for every dollar you deserve. At Michelson Booth, we settle most of the cases we handle. But if the insurance companies choose to fight, well, we're okay with that too. If you've been injured in an accident, choose a law firm that's got the resources, training, and stomach for the fight. Michelson Booth. Don't be a victim twice.
Nestled in the heart of Pensacola, Dorothy's is a one-of-a-kind, community-driven cocktail bar by Oasis, Florida, created to sustain vital HIV and STI care across the Florida Panhandle. Inspired by the Wizard of Oz, rooted in inclusion, and dripping with character, Dorothy's is a welcoming space with award-winning Oz-inspired cocktails, food by Steel Pony Diner, and an unmatched atmosphere. Join us 7 days a week in downtown Pensacola, located directly across from Maritime Park and the Blue Wahoo Stadium.
Step into your hometown boot store right here in Pensacola, Florida. The largest selections of Western boots and attire, including our own style of custom Anderson bean. The boot store also carries a great selection on workwear from boots to fire-resistant clothing. When you're looking for authentic wear, accompanied with authentic service, show up at your hometown boot store where you're more like family than you are a customer. And remember, the savings and selection are found behind the big red boot.
At FPL, we plan for storm season all year long. We're strengthening poles to better withstand severe weather. We're clearing lines to improve resiliency, and we're constantly training teams to act at a moment's notice. Because we're always working, always preparing. So when storms do hit, you can count on us. FPL, working for you every single day.
Lot big. And welcome back to this conversation today we're having with Baptist. And it's like this. We're talking about so many things that are so important for the community. For instance, like when we use a simple word like population, we never thought about that has something to do with health and the population, how you care about it. All I'm thinking about is, ooh, there's a great big population here in Pensacola, but there is so much more that connects to that one word. And the hard work that go behind it, even with the coding, 9999999. I mean,
right. You didn't flatline the people.
I mean, but there's so many things that I'm real. When I get quiet.
Oh, let me tell you how Emily's team. Remember when we did the tour at 9 Mile, which we gonna do again at 9 Mile?
We'll be right there with you.
Yeah. Remember how we had the mammogram people? People come and get mammograms. People come and get prostate. So what Emily's team did was they looked at a list of people, what we call gap. They had gaps, like gaps in care, that were eligible to get mammograms and called them to make them appointments to come. So they can see the back end of like, okay, there's Joy, she needs a mammogram, we need to do this. Or she needs a colonoscopy, we need to do this. And call them to schedule those appointments. So she was even helping, their team was even helping us.
And
I'm saying, remember, they were at that front desk when you walk in and they were making appointments for people that needed primary care. That was Emily's team, part of Emily's team.
And that's part of what we do to expand this population health vision, particularly in primary care.
Of course.
But we schedule appointments not only with the providers, the family doctors themselves, but we also schedule a very specific type of appointment that often people don't realize if they are insured that they have this benefit, and it's the Medicare annual wellness visit.
Yes.
So on top of all of those gaps in care for preventive services and lab work and things like that, there is an annual visit that Medicare beneficiaries are eligible for once a calendar year. Well, once every 365 days. So it depends on when your last one was. But you're eligible for this visit, and it is a head-to-toe assessment along with all of your preventive services, any risk factors that you may have. The provider goes over with you and creates a plan of action.
Does the people know that they have this? I mean,
that's
what she does to make sure they get
we
that.
outreach to them. So we get lists from the insurance companies that tell us who the patients are that have their insurance and are eligible for the visit, and we outreach to them. We call them. We send letters to them. We send text messages. We have programs. Yeah, we try to get in touch with as many people as possible because it's a benefit, like I said, and it's one that's often overlooked because we are, with population health, we are transforming healthcare delivery. And we're moving away from that transactional healthcare where something goes wrong and the patient calls and tells us, I need help. We're moving towards a more proactive, patient-centered approach that allows us to mitigate things before they become worse and before it becomes a problem that we have to fix later on.
Right. And so our departments are like cousins.
First cousin.
Yeah, we first.
Yeah, yeah.
Our mamas were sisters.
I hear you.
And so the thing about even with that, so we were just talking about Fricker over the break. The groundbreaking or the actual, it's tomorrow. Tomorrow morning.
I know, because I got an email, so I'm going to be there.
Yeah, it's tomorrow morning. I won't be able to be there.
Oh, I made it so I can be there.
I have a procedure, so
Gotcha.
y'all be praying.
I'll video some if they let me.
Okay. Casey will be there on our behalf.
Okay.
But when Fricker is transformed,
yes,
we're gonna have the first health hub.
I know.
And who knows? Maybe we can get one of the providers to come and do these wellness things out of Fricker, maybe once a month.
Yeah.
Because if you're 65 and over and you have Medicare, you almost eligible for these.
Exactly.
Yeah.
And so I'm excited about that because
when you say excitement about what they're doing with the Fricker, I could just scream. I've been over there at least 15 years, right?
Yeah.
I mean, that community, I feel like even when they called me and said, well, Sonshine, you can't even come exercising here no more right now, right? Because they've shut it down. I felt so empty. And LaToya texted me and said, it's going to be all right. We'll be back.
It is.
But the Fricker to me, and I'm so happy that it's going to be that hub there, because of the necessities that are in that community.
And it's going to be shared with Career Source Escarosa.
Okay.
So it'll be like a lab for people to come and, get skills and jobs. And then it'll be another part for them to, if they have to do a telehealth appointment, they'll be able to plug in and do it. Yeah. So we really put thought into what it'll look like. My entire team will move into Fricker.
Really?
Oh, really?
Yeah.
Oh, wow.
Oh,
but
that's
let me say
exciting.
something. And I want to say this to my lovely, lovely, lovely people that I love. I just got this epiphany. When you said that, what the Fricker is coming to, and just think about this, the fret that was taken away when Baptist moved. When Baptist moved, when we had all of the meetings about what do you want to come to the Fricker, what do you want this to play a part in the Fricker, I am so pleased to hear that because now I see they heard you.
Oh, we heard.
They heard
yeah, we
you.
heard. We heard. And we have not abandoned that community.
That community, now you have not been abandoned. It's only a couple of blocks up the street, but they brought it right back down to where you are at. You can walk there.
Now, it won't be a physician.
But of course.
But it'll be wellness classes and exercises.
Exactly.
And it'll be some things for the seniors to do to keep them and their quality of life together.
But, the point that it just hit me like a light bulb. Because I was at those meetings when they were so hurt.
Yeah.
What are we going to do? This is our area. I may not have a car. I may not be able to get to Brent Lane or whatever.
I mean, we even fixed that part because
yes,
there's a bus that runs from
right there
to there. And we built the bus stop on our campus. There was no bus stop on that Brent Lane.
Right.
And
look at that.
Yeah.
Isn't God amazing?
He is.
I mean,
and people always want to be heard now.
I mean,
we heard you. We heard you.
They heard you, and I'm screaming that because that couple of those meetings there was a lot of screaming. They were so afraid that they were taking everything away from them. But look at this now, right there in that same spot, they're giving you more than you had.
Yeah.
I mean, you can still walk there. They are they're upgrading you, number one.
Yeah.
And a total upgrade. But you know how bad
handicap ramps, we
get
everything. Like we
everything.
And
a
commercial kitchen.
Thank you.
Oh, we don't have to work so hard for Thanksgiving.
I mean, but this is the part that makes me smile, and that really, when you said that, and the capacity of what's coming, hold on, God got it. I mean, and that made my heart go boom, boom, boom.
Yeah.
And then you're moving your team over there.
So that if you have a question, they'll be there. Walk on in. I mean, no, there will not. Let me say this. It's gonna be well care.
Amen.
Wellness, not health care.
Right.
So there will not be any doctors there.
You will have to educate once you get there.
Unless we partner with Population Health to come in and do some of those Medicare head to toes. But it will be, if you need to come in and ask Holly a question, or ask Jasmine a question, or ask Joy a question when I'm down there. Like our friend. He could just come to Fricker.
Wait a minute, we're going to have him on the show here.
Yeah, we don't have to put him on the show.
We got to put him on the show.
Yeah.
That young man, he'll wait. When I was downstairs, he would look over, he would wait for me. I need to talk to Joy.
Oh, like he didn't have my phone number.
I mean,
right?
Sonshine, I need to talk to Joy.
But that's relational.
That's relationship right there too, baby. That's when you build, and I'm strong on building relationships because that means that that person has seen that I am a person just like you are. You can come to me and share with me the things that I need. And the way you guys are breaking down population health to me today, it is like I'm in elementary school, but the fact of it is I didn't look at it that way.
Yeah.
And now, and I'm sure I'm not the only one that's on that bus.
But let me explain it. So remember, you had multiple siblings growing up, right? Well, I had multiple children. I didn't have multiple siblings.
Oh, yeah.
So when somebody came home and had the chicken pox, all y'all finna catch the chicken pox. Because I'm not gonna take all, we gonna make sure everybody.
Right.
So, you know, we've been doing as a culture, we've been doing population health for a long time, right?
Yeah.
So that's how we made sure that we could control what was coming in and out of the home.
Exactly.
Right? Same thing. We're going to look at this whole, sometimes we drill it all the way down to a zip code.
Yeah.
I had that on here too.
Yeah, when we talk about 32505 being the sickest, biggest zip code that we have, now we're seeing things change a little bit. 32505 is still the hot spot, but now we're seeing 32514. So what does that mean? 32514 has more affordable apartments, so people are migrating.
I gotcha. I see.
It has become the apartment mecca.
Okay.
Yeah.
Wow.
Yeah.
So more people live there, you know, more.
Exactly.
Yeah. Right.
And I mean, but I'm just so pleased to hear the things that we are educating you on. You see, when I tell you that's what conversation does, conversation creates a change. Look at the stuff that I didn't know by just that one word. And I'm sure you're the same way. But this is what this is all about. We are all about the community. We put the community first to try to make sure that you are kept, you know, informed on things that's beneficial to you and your family, to educate you on things that you need to do to better yourselves. I believe that we can take that much every day and better ourselves to become this way and that way, to become more and more, to be that person that I am self-sufficient, that I know what to do, I know how to call. I know what I need to do because of the steps that you guys are taking to make it even more so, much simpler for that person who may be lacking in that area to know how.
Right. Absolutely.
That's what I'm talking about. Ladies and gentlemen, we got to go take a break. They're telling me, take a break. I say, we're going to take a break. And I tell you, this hour, of course, is all about Baptist. 75 years.
75 years.
75 years. That's almost, oh, Lord, look how close you are to 100. Ladies and gentlemen, we're coming back with more information right here on Sunshine's Corner.
For 75 years, we've been caring for families, creating jobs, and working to build a healthier community. This is your home, and ours too. We're honored to be the trusted partner in your care. Baptist Healthcare, here for you then, now, and always.
I'm Kathy Holsworth, Artistic Director at Pensacola Little Theater. Join me on the first Monday of every month at 7 p.m. for the Center Stage, where me and my artistic friends talk about all things on the stage and at the Clark Family Cultural Center. Join us, won't you?
Take a breath and step into something green. At Pensacola Seed and Garden, both of our locations are open 7 days a week, ready when you are. We don't just sell plants, we grow many of them right here, with care you can see. And once you take one home, you'll find everything you need to help it thrive. Visiting from out of town? Discover unique exotic plants you can bring home, often for less than ordering online. Pensacola Seed and Garden. Grow something beautiful.
And welcome back to the hottest spot in town. I tell you, if you all could hear this conversation after the if you could hear the conversation off camera, you would say, oh my God, they need 3 hours. But the fact of it is, we're having a great conversation. And you see, with me, knowledge is so powerful to me. And I think when I learn something, there's a light bulb that pops on, and it just does me joy to find out about the things that you think you know. There's so much more, even down with population health and the dots that connect on how you guys work together. But when it all boils down to it, it's all to do one thing: you're taking care of those in the community.
Yep. And you know how our listeners call. I got a call last week from a young lady. I won't say her name on camera because I'm bound by HIPAA.
Right.
And she says, I need you to find me an internal medicine doctor.
Okay.
I said, okay. I said, well, let me give you the number. I have the number.
I
got it off of Sonshine. I watched it. But we were able to get her what she needed. It wasn't the outcome that she wanted, but it was what we had.
Exactly.
And so, you know, when you think about that, to be in touch, and the same thing, how when our friend came down, if her team, someone on her team, one of the navigators come up to something and they have a halt, they called me. Joy, we had a guy that didn't have any food.
Yep.
What?
Any food. He was a cancer patient.
No food.
No food. And so the easy thing would have been for us to go to the grocery store for him.
Yeah.
But I just told you he was a cancer patient.
Exactly.
Right? So we got with Melissa. Remember Melissa?
Yeah.
Melissa, what he only really needed insurers. Baby, we was sending insurers, making sure. I mean, it's all about what is needed.
Exactly.
Because we could have sent him some green leafy vegetables and some cans, but at that point in his
he needed what was all that nutrition was in that can.
In that bottle. Yep.
In that
and
bottle
so
right there.
it's just things like that you know, people we never hear, we never talk about, but it's what happens behind the scenes.
I want to say this, and as you were speaking, and you as well, Emily, for what you do, how you connect those dots and the outreach that you do every day to reach out to make sure these people, text them, you got to find out. You are reaching out to make sure that they're taken care of. I want to say that I thank God for that. Why? Because, and this is not being boastful in any way, but this is the only entity that you're going to get this kind of information. That's going to give it to you live. That's going to give it to you where you can find out where to go, how to pick up the phone and call Joy, how to pick up the phone. Sometimes I missed the number. Let me call Joy for you. But what I'm saying is, though, that was the purpose. Give God the glory. To have an avenue that we can be that link for those who need it. There are people at home. There are retired people at home. There are people that I talk to. And for those that I never get a chance to tell you how appreciative I am with you because of the fact that without you, there's no me. That you will inbox me. You'll grab me in the grocery store. You're Sonshine. Oh my God, thank you so much. Oh, I could hear your name come up as much as mine because we do this and sometimes we have to make more shows. We have to bring you in more than once to get the message across. But I think that's what the avenue is because, and don't take this away now, I've been in radio for a long time, but I couldn't go this deep. I could only talk 2 minutes. And if I talk 2 minutes, I was going to get yelled at. You understand what I'm saying? Because you're not supposed to have but 45 seconds to 60 seconds to talk between the songs. And with this, there's an avenue made so that we can give the community what it needs. Not got to say too Baptist Healthcare. You've been with me since the first week I got here.
Yes, we have. Yes, we have.
You've been with me since the first I got here.
And we are not going anywhere. We are not going
anywhere. And I want to say to you, to Mark, to my girl, Casey, y'all came in that show. I go back and look at that myself. But I want our viewers to realize when there is an entity here where you only see what's right before your face, I'll say this because of the uproar that was about the old Baptist that's been there for 100,000 years. But look what God has done.
It ain't been there. It was on like 70 something.
I said 100. But it's been there a long time.
Yeah, it has.
And you have become comfortable. But God, He wants to elevate us to have more than what we can think or imagine. And that's exactly what He did. Look at this. You got a new facility right down the road. For those who still think they can't get to the healthcare, now you're putting a whole hub there at the Fricker Center, who is in the dead heart of the community. So therefore, what am I saying? Don't take your trust out of God.
That's right.
He knows what we need.
When we need it.
when we need it,
and how we need it.
and how he's going to put it there to fulfill that need. All we got to do is trust and believe in him. And I because there is so much that we have discussed on this show that I have learned that I didn't know, Emily. I thought by just, yeah, well, that was it. But the depth that we have gone in to educate our community, to let them know that there's somebody who cares. And when you can get the CEO, the big man, to come in, and when I learned his spiritual side of what he said about this, all I could do was shut up then.
And live. So that means anything can happen at any time.
Anytime. You know that's right. But I say all that to say, but all this information, what you do, Emily, I think is absolutely phenomenal.
Well, and I have to agree, it's God-given.
Yes, it is.
And even my team, I have a team, a small but mighty team of 6 care navigators, and we are grateful to God on a regular basis because of what we're able to do for our community. Yes. And we use this data, we use this information so that we can make changes for people.
Exactly.
Make their lives better in some way, shape, or form. Mark is incredible. I actually did a talk for him at his parents' church out in Milton a couple years back with KC.
Mark's dad. If you think Marta, who his dad?
His dad and his mom. They're pretty incredible.
I love my sister Mark, okay?
His dad is
he's so real.
Yeah, you gotta meet his parents. They're pretty cool too.
Yeah.
Wow.
But yeah, so I'm happy to spread the word because not everybody understands that this is what we're trying to accomplish in big ways and small ways. You know, we're trying to touch each individual patient, but we're also trying to make a change in our community.
Right.
Do you know something else I'm noticing about as the both of you talk? It's not I, it's we.
Oh, no.
It's we.
It is we. I couldn't do what I do without joy, without,
But as you were talking, you said, well, we have a small team of 6, but we do this. And if we didn't do this, then we got to do this. It's we. It's never I, because you can't do it alone.
That's right.
You got to have that teamwork. As Dr. King would say, make the dream work. I mean,
that's right.
But I say that to say we've done so much. And ladies and gentlemen, when we take the time, as much as I'll text you, call you, say I need this, or can you help me with this, what do you think about that? That's because you've let that guard down, that we have become more than just client, you know. We're more than that. We can talk to each other about if I feel like, wow, my head hurts. I'm just using that as an example.
Like I get on her about going to the emergency room because she got gas.
Oh, okay. Yes.
Don't do that.
Let's get you set up with a PCP.
She got a PCP.
Oh, okay.
Wait, I woke up one morning.
Yeah, baby. Here we go.
And I said, oh my God. Then I felt something. I said, oh my God, am I having a heart attack? And then I really,
but you did the right thing because
Niggas
there's
go
3 reasons why you should always go to the ER and never wait. Chest pain is one.
Yeah.
Stroke symptoms. And trouble breathing.
On that side?
If you can't breathe, then you can go to the ER.
Baby.
Otherwise, try and call your PCP.
You got to where I'm going. I mean,
but let me put a shameless plug. If you live closer to 9 Mile or to Navarre, go into the freestanding.
That's it.
What they do is they triage you and they take the decision out of your hands on whether you can go to urgent care or the ER route.
I got you.
Thank you for telling me that. Urgent care bill is a lot smaller.
That's right.
Some money.
The ED bill.
Tell me, thank you.
Copay.
Thank you very much.
Yeah. So
now we were talking about the SCI, what Quint Studer.
Oh yeah, you want to think about population health, like what Quint does, what SCI does. Quint, Katie, the team over there, amazing.
Yes. Hey,
Sonshine
guys.
and I both sit on the board of directors there. They look at 2 populations. Building brains, with little small people.
That's right.
And building jobs with
That's right.
entrepreneurs. That's population focused. You don't find them doing anything other than those.
That's right.
Yeah.
They
So
don't
focused
waver.
on it.
That's right.
So focused on it.
And that's basically Emily's team. They're focusing on care gap, closing those care gaps, and making sure people get what they need and they don't waver in between.
Absolutely. You know, and I'll say this to anybody, and I say this often, I have to point his props. Even with the guys there when we talk, I've taken some things when I sit there and I'm quiet. I mimic some things. You know what I'm saying? Because if it works that way, whatever I have in my focus to get done to make it better for the community, I'm going to watch you because you've been successful. And I'm going to use some of that to add in where I can to be more successful for the community, because it's all going to end up
That's right.
right there.
That's right.
We're connecting all the dots. And that is something I think that everybody, when we bring this information to you, it's not because we just like to sit here and laugh and talk.
Right.
We're finding a way to educate you so that you can feel, oh, I can tell my cousin said, okay, let's go over here. If this person calls you, now they call it on to make you, get you healthy, to make sure that you're okay, stay within those lines. And that is why it's so important that we bring this information. And when population not coming, somebody asked me that, and I'm going to go, let me tell you, what did you have? Do you know that? I'm going to get to talking like
Are you 65 and older?
Yeah, let me tell you about your Medicaid.
That's like one of them commercials. Do you know?
Did you know?
Yeah. Hey, that's a good promo though.
There you go. Did you know?
And there's a lot of healthcare that people don't know.
Right.
Exactly.
And it's easy for us to fill those gaps and help them throughout the care continuum.
Exactly.
Right.
Exactly. When it comes to population health, I want you to break this down into one thing. What's population health? Just tell them so they'll understand in layman's terms. We have talked about this, A, B, C, D, E, F, G. My name is Susie. What is population health?
I'll tell you exactly like I tell everybody else when they ask me what my job means. Population health is literally just taking information about a particular population of people and applying it to better their health outcomes.
There you go.
So when we say population, veterans,
Right.
women, marginalized communities, people of color,
Right.
our LGBTQ community, all population.
Exactly.
Everybody
I can even
needs
break it
something
down
different.
by condition. People with diabetes, people that have hypertension, people that live in zip code 32514 that have diabetes.
Okay, let me ask you something. When you say 32514 and the population there is so overflowing with diabetes.
No, she didn't say that.
I'm going to
As
my
an
question.
example, yeah.
I'm going to my question. Now, what zip codes do you find in your search that is more likely or having more of diabetes?
That's a really good question. So what we find is that the higher concentration of
don't bite your tongue, just say it.
lower income
That's what I want to hear.
and socioeconomic status is where we see the higher prevalence of the chronic diseases.
I understand. Now, I also understand by doing my research last night, you teach people how to be more healthy. So therefore, if I'm going to use, these are only examples. If I'm in 32503 and you find out there that there are more diabetes because of that, then when it comes to eating, we got to show them how to eat to help combat that problem.
Exactly. Yeah.
So we got somebody that's going to go in and say, hey, look, Miss Susie, don't fry that chicken like that all the time. Put it in the oven and bake it.
Or we'll partner with a church in that zip code and let them have a diabetes management class so that people can walk in to learn. Right? Because that's how the whole continuum works together.
Right.
So if we see, like, for instance, we have world-renowned orthopedics.
Right.
But if you're getting a total knee or a total hip, you can't get that without a walker. You can't even go into surgery without a walker. What a lot of people don't know is Andrews Baptist, Greater Little Rock.
Right.
We have a way for you to go into the community and get a free walker so you can schedule your surgery.
This girlfriend of mine that used to walk with me just had her knee replaced 2 weeks ago. I saw her when she got home. She was on the walker. And because she said that she had the surgery that morning
and went home. When?
Yeah, she had to walk that same day and go home.
Yeah.
And that walker may have been a cost to her.
Yeah, because they can cost. Yeah.
Oh my God. Okay. Twin, I'll just say that. Ladies and gentlemen, we're having such a conversation here that's covering so many areas that we deal with every single day in our lives. We'll talk about your loved ones. We're going to talk more when we return with Emily and Joy right here on Sunshine's Corner.
Hey folks, Winston Lindsay here with Living Southern Homes in Bruton, Alabama. We just want to remind you our new show will be coming on at 5:30 on Mondays on Blab TV and also Thursday at noon. Don't miss these opportunities. We will see you then.
At FPL, we plan for storm season all year long. We're strengthening poles to better withstand severe weather. We're clearing lines to improve resiliency, and we're constantly training teams to act at a moment's notice. Because we're always working, always preparing. So when storms do hit, you can count on us. FPL, working for you every single day.
The Emerald Coast Utilities Authority's state-of-the-art materials recycling facility processes recyclables for communities throughout the region, lowering need for more landfills. This highly efficient recycling service accepts glass, paper, cardboard, plastics, aluminum, and more. But we need your help. Please make sure your recyclables are clean of garbage, food, and liquids. Also, please remember that plastic shopping bags, foam products, or yard waste are not recyclable. To learn more, go to livegreenecua.com.
Well, I think it's all about local, and I'm a big believer in local. So I think anytime you can carry a message out locally, it's important. And I think it's anytime the person that delivers the service can also deliver the message, which is unusual. You have the people that actually deliver the project doing the talking, and I think that's a huge difference and really makes a huge value difference for the consumer. So I'm really just so grateful that we have this local opportunity with Blab TV. My name is Quint Studer, and I am Blab TV.
And welcome back to the hottest spot in town on a cloudy day on the outside. Sunshine here with you, and we're having a great conversation. Of course, we're talking about health. We're finding out so much more about population health, and it's amazing how, with technology as it has grown, you can find out anything you want to. Just think about that. By connecting this, they tell you what the insurance company say about that, then how to call and tell you to get this to take you there, and take my knee, but you're going home this afternoon. I mean, and you're going to walk before you go. Oh, God, I told my girl, I said, how in the world did you do it? She said, honey, it was okay. And I got to go to therapy on Tuesday. That's what you just had this today.
Yeah, when I had my shoulder done, I went home the same day, but within 2 days, I was in therapy.
Didn't it hurt more?
No, because they know what to do. You ice it down and you do all this stuff. You gotta trust the process.
I'll try. Yeah. Okay, I got you. But I can't believe we've talked to. It doesn't feel like it's been an hour, because when you're talking about something that's good and the knowledge just comes out so smoothly, it amazes me how quickly it does. I want to send a huge shout out to a young lady by the name of Yvonne Capehart, whom I love with a perfect kind of love, who I've known for quite some time. I hope you got my text yesterday. Pastor Lee, thank you. And a lady that teaches and walks a walk. I think, so many people talk the talk, but she walks the walk. And I love her dearly. And you're coming back. I told you about getting a new studio. I'll be talking to you soon. But she is such an inspiration and I love the fact that she's an example for women, for family. I got to say this because back here last week, while she was doing it at home with the kids, they had a cook-off. I was laughing so hard. She said, I told my aunt, you'll get your own because you can't use my pans. But she did that with her grandbabies, right? And those are examples where I think sometimes when love is in the equation, it's better for the health.
Oh, absolutely.
Can you imagine the love that those kids are having now? I mean, what they're going to take right on to their families, even their babies. You understand what I'm saying? Yeah. And I say that to say this. When you look at I don't call this a job. Because when I do something I love, I'm not working. I look at what you do. The life that you affect every day, that's not a job.
No.
That's a special gift from God.
It's a calling, yeah.
Yeah, calling on your life to make sure that you take care of those out there who are lacking in that area, because you take me in certain areas I wouldn't know what to do. But look at what you all are doing. Don't you feel special with what God has chosen you to do? That He entrusted you with so many lives. Not just yours, not just your kids, not your husband, not just your immediate family, but His entire family. Yeah. I think that's amazing. Before we get out of here, Emily, I want to say thank you to you. You got to come back because, girl, you fit right in.
Oh, good. I would love to come back. Yeah.
You fit right in. We, even on the elevator, you fit right in. What would you like to say to our viewers before we leave?
You know, you mentioned something just now, you know, about the calling and being special and being called to do this work. And I definitely feel that. I am unfortunately not clinical, and so I don't have the ability to heal someone.
That's right.
But I can use my skills to help them through the other side of healthcare.
Exactly.
And I feel like that's exactly what my team does.
You're doing a great job.
We hold the hands of the patients, get them through their journey, and try to make their lives better along the way.
You're doing a good job at it, honey, because you told me some things I did not know. Okay. That I'll be able to share with her. No, you do this first. And Joy, you got 30 seconds, because I know Joy going to take the rest of my show. Joy, you got...
No, I mean, I'm just soaking in the fact that you talked about calling. This has never been a job to me. This has been a mantle.
Exactly.
And sometimes it gets heavy.
Yes, it does.
And sometimes, you know, you wonder, am I doing enough? Did I do enough?
That's me.
And you know, that's human.
That's human.
But I thank God for the residents of Pensacola. I thank God for Baptist Health Care seeing the need to have programs like ours.
Exactly.
To be able to meet the need of the populations and the community and let that overlap to help people throughout life's journey.
Amen. I love it. So look, she got that slogan in there. There you go. But guys, I tell you, we've talked about a lot today. I cannot thank you ladies enough. We're going to do this again real soon. You know, we do it every month. But look, we've got to get out of here. But I want you to remember, if there is something that you need, God has already opened the door that you know what to do, how to reach out to get it. And he's making it so simple that it only takes, just say, hey, look at this other guy. He can be the perfect example. As we leave, ladies and gentlemen, I want to leave you with a thought. Never, ever, ever, ever lose your focus. Always remember, if you keep God first in whatever you do, I'll guarantee you this, you're going to be a total success. So until tomorrow for another day of sunshine, know that I love you with a perfect kind of love. Go out and tell somebody you love them and mean it. Until then, keep shining while I'm gone. Ladies, take the sunshine with you wherever you go. You are my sunshine.
Just a small town girl with a big old dream. Now she's taking it over and making a scene. Yes, it's your turn next, so please take your seat. 'Cause baby, the best is yet to be seen. Good morning, sunshine. Good morning,
Sunshine's Corner, being brought to you by Quint and Richie Studer.